Okay, so I'm going to be talking about individuals with pornography and sex addictions. This is mainly going to focus on people who have pornography addictions, just because there was more research widely available about them. But a lot of the information can also cross over to sex addictions as well. They're kind of on the same playing field. So to begin, I just want to start by discussing some of the health concerns that were from my previous PowerPoint. And mainly, I wanted to talk about the social determinants of health that people in this population are up against. The main one that I was able to find information the most about it affecting them was within this social and community context. So people with pornography or sex addiction are typically most susceptible to poor mental and emotional health. They have lower offline functioning, loneliness, depression, anxiety, decreased intimacy, all those kinds of things. And they also are subject to lower cognitive functioning just because it affects their ability to focus and causes higher stress and attention problems. So how does the media see this population? So there's a lot of debate actually out there about if pornography addiction actually even exists. In the world, there's a lot of people who feel that pornography is a helpful thing. Other people think it's really harmful. So there's just a lot more, conflict about it than I was originally expecting to find out. But many people typically will agree, at least in the professional community, that it can be, it does exist as an addiction. A lot of people in media might also say that pornography addiction is a gateway drug to some really deviant forms of pornography. And then also media definitely portrays it as more of a male problem. So in individuals who have this addiction, it's really, really crucial to have family support. It's important to get professional help first and foremost for this issue, for both sides, for family members, for spouses, for the person actually affected by the addiction, because there's just a lot of things that can be affected in your personal relationships when it comes to this addiction. For those who are loved ones of somebody with an addiction, it's important to really have clear boundaries and guidelines, give that person opportunities to be accountable, listen to them with good skills, and not be judgmental, because that's kind of the worst possible thing you can do to anybody that has an addiction, not just with pornography. Give them time to actually heal. It's not all about your timetable. It's about what's best for them. And then you also make sure to have some realistic expectations. That's really important. So the role of peers, it is pretty, especially within teenagers, it was pretty obvious that peer pressure played a big role in people's addiction journey, I guess. It says that studies have shown that boys who were found to engage in the use of sexually explicit material in social networking sites received more peer approval and indicated greater experience considering their sexual involvement. So that peer approval is something that really enables them and makes them want to continue to view pornography and other sexually explicit things. And also within teens, this addiction can be a lot more destructive, especially to their personal relationships and their ability to find intimacy in those. Also, another role of peers for people who are affected by pornography addiction is those who have support groups, or who are in support groups, I should say. They find a lot more, ability to get through it when they surround themselves with other people who are going through the same things. So, as with most addictions, this tends to be a really cyclical kind of pattern that people with pornography addiction experience. There's a lot of things that might trigger them to want to view porn, or they might also find that they start to get better and then maybe they get triggered again and they start to relapse and fall back into that cycle of viewing porn frequently. Okay, so within our legal and political system, mainly within Utah, I was finding a lot more information about this, but because of the abstinence-based sex education laws that we have here in Utah, that does tend to cause a lot of curiosity within teenagers or younger kids especially, because they have a lot of questions about sex. And when I don't mean for this to get political, but when our laws here in Utah especially prevent them from learning to the fullest degree just kind of about the main bulk of their questions about sex, that does tend to invite them to start seeking it out other places and can lead them down a lot of dangerous paths and potentially can make their addictions worse. So let's see. I did find an article recently in the Deseret News that said that in Utah law, it is mandated that health classes, which include sex education, be taught using abstinence-based lessons that promote chastity as the most effective way to prevent sexually transmitted infections and the only guaranteed way to avoid pregnancy. Health instructors can briefly mention contraception, but they cannot advocate for it. Many skip it altogether to avoid overstepping. So this could obviously present a bit of a problem when it comes to teaching kids about sex and preventing that curiosity that can lead down some dangerous roads. So there's a few different barriers that could come up for those who are experiencing pornography addiction. Within Utah especially, there's a lot of cultural and religious shame and different things like guilt and lack of empathy that they might experience within our chastity culture here in Utah. A lot of people also might see somebody who is viewing pornography as someone who is evil and unclean. There's a lot of negative stigmas about poor mental health, and also, like I mentioned before, talking about sex does tend to be taboo here. So those are some of the barriers that they might run into when it comes to seeking help or finding some kind of treatment to help them. For the international scope, the question was, are there regions of the world in which this population would be in danger or shunned? Honestly, I really couldn't find a whole lot of information or think of anything that would cause them to be in danger in different parts of the world. I think that this is a problem that affects people all over the world. I don't think it's specific just to America. So with people who are going through this addiction, they typically are it was found in a study, I should link it, but I found a study that said that 75% of all people who have a pornography addiction or who at least view porn are earning above $50,000 a year. And so they're able to afford access to the internet. They're able to, unless you're not making enough money, you're not going to be able to find any of these inpatient rehab programs, which can be kind of expensive. Also, therapy costs can be pretty expensive, especially if you're working outside of your insurance or what is covered. It can be pretty expensive. I did find in an article that it said that treatment for sex addiction and sexual behavior problems are rarely covered by health insurance, Medicaid, or public funding. So that could also present a problem for you if you're trying to seek out some treatment. It might just be that your insurance company doesn't really recognize that you have a problem, which could be pretty difficult. Let's see. So within race and ethnicity, some of the problems that are experienced is a lot of the research suggests that there's a pretty big lack of diversity represented in people who have pornography or sex addiction problems. It's typically white males with a higher income, and historically they've just kind of led a privileged life as far as being more open about their sexual behavior and promiscuity. It's kind of all throughout history. You might see it with like the kings or the knights or like a whole bunch of different things like that. So those are some of the things that could come up for race and ethnicity. It's just a white male problem in most of the research's eyes. Let's see, when it comes to religion, there could be a lot of different emotions. There could be some shame, some guilt. They might run into problems when it comes to this chastity culture that was mentioned before. And like I said, sex education. especially here in Utah, that could also play a role. Let's see. So as I've mentioned before, it's typically for people with this pornography addiction, it's typically seen as a male problem. So some things that might delay or prevent people from seeking treatment, especially if they're like female, is there could be just that stigma that it is a male problem. So it could be embarrassing, or they might feel a lot of guilt or shame. Women could and not want to seek any treatment. So that could be a problem there. Let's see. So some other issues could be that people who live in kind of more rural areas or live in a geographical location that makes it difficult for them to seek treatment, they just might not have access to those treatment programs just based on where they live. Because of this, though, there's a lot more options now than there ever was before, especially because of COVID, to have telehealth. So they could find some kind of telehealth therapy program or treatment program. I know of one for sure that's called BetterHelp. That's a pretty popular one for telehealth therapy. There's also Facebook groups, or maybe even just some virtual programs that you could do for support groups and things like that could help you get through your treatment. So some of the implicit biases. It is found that most people, just goes for addiction in general, a lot of people may see addiction or people with addictions as people who are dirty, or maybe they're unsafe. They don't really have much of a moral compass, or one that's different from yours. And a lot of people also see them kind of as criminals. It just gets really demonized and weaponized. This idea of having an addiction, whether it be to drugs and alcohol or to pornography, just a lot of people tend to demonize those people. And they don't realize that they're doing it. I mean, it could be totally just subconsciously, but unfortunately there is a lot of that stigma that kind of exists. And then as far as explicit biases, again, this could be more obvious, and you might put it out there a little bit more. Just somebody who might not have the same moral compass as you, their decisions to view pornography might go against your own moral compass. And so that could be an explicit bias that you hold against them. You just kind of are judging them for their choices, when a lot of people, it's not really a choice that they make. It's more of just like a way to numb themselves and kind of escape from negative feelings that they might be experiencing. So let's see, from the international scope, let's see. So there isn't really much of I think the question was, is there a place in the world where these people might be in danger? Oh, no. Where these people might experience this problem. I can't remember the exact question, but basically what I found is that pornography addiction affects people from all regions of the world in the exact same way. Most people will reach out and use pornography as a way to kind of numb themselves from negative feelings that they're experiencing. So this could be hopelessness or loneliness, anxiety, depression. A lot of those really negative emotions that people tend to feel, they have found an outlet and a way to kind of numb the pain away by viewing pornography. And it can get to a point where it becomes just extremely all-consuming in your life. So internationally, I would say it's a problem that all people experience, no matter where they live. And that is the end of my presentation. Thank you for watching.